Really is a privilege to be with you here today as part of this excellent event, and I do appreciate the opportunity to speak with you all today. So I've been asked to focus on local area coordination's role within prevention. I think there certainly are other dimensions to it, namely how it supports people who are already accessing services to reduce a need for services in their lives, but I'm going to focus on the preventative aspect here. So local area coordination is an approach that emerged in Western Australia back in the 1980s, but it's been in England and Wales for the last 10 years or so. And it's currently been led within 10 council areas in England and Wales, and it's been rolled out across 100 or so communities. So local area coordination is an asset-based approach, but so focused on, like what Glyn was saying, on strengths and what's strong. But we're often asked, what is the problem that local area coordination seeks to solve? And I think reflecting on that, there's probably three interconnected issues that the councils who are driving this forward are trying to work on strategically. I just wanted to share here. Firstly, I think many people in our society are still not able to achieve their vision of a good life for whatever reason. And this, as we know, and from what we've heard there, is often due to some form of exclusion. For instance, exclusion from family, from community, from information. But when we're thinking about prevention, also exclusion from services, through eligibility, through thresholds, through funding, that sort of thing. And secondly, communities often evolve and develop without the involvement and contribution of those people who are facing exclusion, because they are on the fringes of that community and because the fact they are excluded. And this is a loss, a huge loss, and it increases the likelihood for personal crisis as people remain disconnected and isolated, unable to share their gifts and make their contribution. And finally, I think our statutory services are designed to be reactive to crisis through specialist responses, siloed specialist responses and interventions. And they're not necessarily designed to think about the whole person and to work in a way that's preventative, to build capacity at individual and community level. So those are the kind of challenges that we find people are exploring when they get in touch with us about local area coordination. And when we dig a little bit deeper into all of this, we often find that I think there's very few sustainable structures in our communities these days, whether they be democratic or otherwise, that help people to be citizens, to think, to decide, and to act together with a clarity of voice. And this lack of voice, or perhaps an ability or lack of interest in listening to it, means that sometimes policymakers and system leaders are reliant on quite headline deficit data and overview kind of insights about areas when planning and making decisions that affect the lives of the people and citizens. And this often leads to a bias for cheaper, shorter term fixes that might fit the prevailing demand reduction narrative, rather than ones that are longer term, relational, preventative, and driven by values and principles, and that are led with and by citizens. So I think the question those adopting local area coordination are often grappling with is, do we tinker with this? Do we try and fix it around the edges? Or do we try and do something that fundamentally is about reforming that, doing something completely different? And increasingly, the areas that we're working with and where the approach has been recognized, it's been seen as something that can help bring about that genuine reform to the way that social care evolves locally. So how does it work? So very briefly, to give you an overview. So we, the Local Area Coordination Network, work with councils and local communities to co-design a version of local area coordination based on various design features, core design features and principles that have evolved from the evidence over the past 30 years. Local community members are eventually involved in recruiting one local area coordinator for their local community, typically a population of around 8,000 to 10,000 or so people. Those coordinators are then employed by the council, but are based in communities to be present and accessible, to take introductions to anyone who may need help in order to live their good life. And those introductions can come from anywhere. So from local people, from community groups, from services alike. Coordinators take their time to listen, to build meaningful and equal relationships with people, and trying to find out what the bigger picture of someone's vision for a good life is. So not just focusing on one part of it, but looking at the whole thing. And there's no limit to this in terms of time, and there's no limit to it in terms of criteria. There's no referral process either. It's about a relational thing. They develop shared agreements together as to who's going to do what. And there's often a big focus on what local support and connections are available in the community to help people get to where they want to be, with services and funded supports as a backup. So not the first protocol, but a backup. And then the learning from all of this and the insights that are coming back from people, from citizens, from communities, that's channeled back to system leaders who can then make positive reforms based on real-time insights and information and reality of things, and not just old, out-of-date information. So what impact do we see this having? Well, typically it's multiple outcomes in all sorts of different levels. So for people and families, they have a local, practical, accessible source of support there to achieve their good life, and they don't have to be signposted out of their community in order to get there, and crisis is prevented. For communities, they have a locally based, skilled local area coordinator who's present to connect with and introduce their friends and neighbours as concerns, queries, or ideas for doing something different begin to arise. And this helps build bridges and trust again between communities and wider service institutions and structures. And for service systems and professionals, they have a named person who's physically present in community to make introductions with, regardless of service eligibility. So, and this capacity this helps to build, and the crisis it helps to prevent, leads to costs being reduced and savings being created and all that sort of stuff. But it provides insights for better commissioning. I think it promotes culture change across health and social care. It enhances co-production, power sharing, and a platform for better collaboration. So those are the sorts of things that local area coordination can really help stimulate. And I just want to conclude with a short story that I think highlights the preventative aspect of this really well. This is about someone called Ella. It's a true story. Names have been changed and permissions have been sought for giving this and sharing this. Ella was attending college, but her employment advisor was concerned that she had no income. So together they reached out to Tammy, Ella's local area coordinator, to see if she could advise as to how Ella could access free food. Ella and Tammy met soon after in the community where she opened up where Ella opened up to Tammy. She had been denied the benefits she was seeking some 8 months before, and she had no income, no family support, no network of friends around her, and she was facing eviction and had no access to food other than through soup kitchens in the city centre that she was struggling to access due to the cost of transport. Now, Ella's physical and mental health were deteriorating, and she told Tammy that she felt very isolated. And when they looked into the support she was getting, she was receiving quite intermittent support through a social housing landlord, an employment advice service, and a local charity supporting people facing homelessness. So Tammy was able to help Ella join the dots between these services, put her at the center of it so she could get the full picture of what was on offer. And this included Tammy helping a lot with some practical stuff, for example, picking up food parcels for Ella, attending meetings with the landlord and the welfare rights team. And eventually, throughout that time, Ella managed to secure her tenancy until the pending tribunal, where she won her appeal and her benefits were backdated and she paid off her arrears. She was able to focus on her health again. Now, throughout that time, Ella and Tammy were getting to know each other. Tammy had also been helping Ella to meet local people in the community, to build links with local places and things that were going on. So she's met people in the community who are now offering a natural emotional support through friendship rather than through services. And Ellen's now giving back to the local community, sharing her gifts through volunteering, and is now continuing with college and seeking work. She feels more optimistic, mental health and physical health have improved. And she isn't now closed to Tammy. That's not how local area coordination works. She continues to be a presence, walking alongside Ella as and when needed. And Ella knows where to find her because Tammy is present in the local community. She's the local area coordinator. So that story of prevention really highlights, I think, the logic of the approach of being local, connected with services, but also separate, the practical input that's genuinely compassionate and centered on the person. They're not being limited by eligibility criteria or time, knowing where hyperlocal potential natural support exists in communities and making those connections, seeing the big picture and not just focusing on one part of it, and being present and accessible if needed in the future without closing people down so they have to get into crisis again in order to re-access services, for instance. And I just want to conclude in these last few seconds by saying that I think the great value in local area coordination is due to the fact that it isn't solely a community-led thing and therefore limited to the goodwill and the extent of neighbourly support and community infrastructure that exists. And it also isn't solely a service-led thing either, which is limited by eligibility criteria and thresholds. But it's something that sort of lives in this grey space between the two. And when designed right, I think can make a huge difference in building the capacity of both worlds. And I believe at this moment in our history, what we need are responses that bring the worlds of individual citizens, families, communities, and statutory services together in a much more equitable way that plays to everyone's strengths, respecting the natural authority of people, the power of communities, and the value of accessible specialist services when needed. And I believe that the local area coordination approach is well placed to support this. So thank you very much for listening.